Good evening. I'm Chuck Scarborough.
And I'm Natalie Pascarella. All major indicators tonight continue to trend down in the tri-state. But surprising new data in New York. A new state survey shows 2/3 of new hospital patients got infected at home. And most of them were older people of color. Another 18% were infected at nursing homes. In the city, Mayor de Blasio says more than 200 homeless people were removed from the subway last night on the first day of overnight deep cleaning. City layoffs are not off the table as a deficit of more than $7 billion is looming. And 7 miles of streets have been open for pedestrians, with 2 more miles set to open tomorrow. Well, the tri-state death toll sadly has reached 31,144. The number of cases surpassing 484,000. News 4's John Chandler joins us live now in the Flatiron District with the latest. John.
Well, Natalie, those roads opening up again starting tomorrow, an emphasis on pedestrians wearing masks, continuing to socially distance. Meanwhile, city and state officials keep their eyes on a new study that reveals a troubling trend in new cases. And through all of this, of course, keeping eyes on the budget concerns. Mayor de Blasio this morning again floating the idea of layoffs in city workers. With his city facing a $7.4 billion shortfall, Mayor de Blasio says federal aid is the only way out.
We need to get that stimulus done so that people don't have to experience furloughs and layoffs.
The mere suggestion that first responders might be laid off or furloughed in this pandemic drew the ire of the firefighters union.
Our firefighters should not have to respond to emergencies, fight fires, and fight at the epicenter of this global pandemic and weigh unemployment at the same time.
Fearing layoffs, many New Yorkers echo the mayor's push for federal aid.
Yes, Trump helped us with a couple checks here and there, but that's definitely not going to be enough.
The toll still felt in hospitals, where 66% of new cases came from people at home, another 18% from nursing homes. Governor Cuomo worries time will paint a tragic picture of New York's loss.
The reality is going to be actually worse.
Even as the new survey shows 84% of new cases originating indoors, the city still takes steps to fight coronavirus outside. 2 more miles of roads will close to traffic, including stretches of Broadway, starting at 21st Street. That's fine to some.
I think that's fine. It's just the same. But as long as people are social distancing, then they stay safe.
But frustrating to others.
We need the president to get involved. Take over. Because New York is going to be ruined.
The Flatiron Partnership hopes this encourages social distancing.
This is just meant to kind of pass through, walk, get your groceries, pass through, not feel confined to the sidewalk.
The closures will last as long as necessary, much like the cleaning of the subways overnight. Of the 252 homeless removed from cars in the early hours of Wednesday, 139 agreed to sheltering service. The mayor praising the effort, but cautioning that work remains in this coronavirus fight.
Let's keep fighting, because I know we all want that restart. If you want that restart, let's get it right now.
And starting tomorrow morning at 10 a.m., those additional roads that will close to traffic and open to pedestrians include the stretch of roadway I'm standing on right now, Broadway from 21st to 23rd, and again 24th to 28th, closed to traffic, and in the Garment District on Broadway, 36th Street to 41st Street, starting tomorrow at 10 a.m. We're live at the Flatiron District. I'm John Chandler, News 4 New York.
In New Jersey, new cases are inching closer to 132,000. The number of deaths rose by 308 to 8,549 today. New daily hospitalizations and ICU admissions are up slightly, but overall, admissions are down. Governor Phil Murphy says he is convinced his state appears to be bending the curve in the right direction. But today, he extended New Jersey's public health emergency declaration for 30 more days. It was set to expire tomorrow. Murphy is still urging people to cover their faces when they go out and to practice social distancing.
In the absence of either a vaccine or proven therapeutics for COVID-19 specifically, our only cure is social distancing, covering our faces, washing our hands with soap, etc.
Task force to review long-term health care facilities and to make recommendations. Those facilities account for half the coronavirus deaths in New Jersey.
In Connecticut, the number of hospitalizations dropped, 374 new cases. The death toll, though, has risen to more than 2,700. This comes as state officials are laying out the plan to reopen college campuses. The state's colleges and universities will likely reopen in phases throughout this summer. The goal is to resume in-person instruction this fall.
Police say a bold bandit is taking advantage of the pandemic, repeatedly breaking into shuttered restaurants. 18 restaurants in all across Manhattan over the last few weeks. This is video of one of those break-ins. News 4's Rana Navini is on the Upper West Side with what police say is this guy getting away with it.
This exclusive surveillance video shows the burglar checking to make sure the coast is clear before cutting open the vinyl window of a restaurant on the Upper West Side. A minute later, he realizes the entryway door was open all along. Then he uses a hammer to smash his way through the main door and enters the restaurant, leaving behind a mess and taking much more.
It was the cash register was here.
The owner of Ashoka Indian restaurant on Columbus Avenue says the burglar took their cash register with several $100s inside. He also took several tablets just days before the restaurant was set to reopen for takeout and delivery.
Mentally and emotionally, it is draining actually, because this was the second time our restaurant was hit. It was a year ago we were hit before.
In another surveillance clip, police say the same man cut through the vinyl door of Marlowe Bistro on Amsterdam Avenue. The glass door there still broken. It's the same pattern police are seeing all around Manhattan as commercial burglaries are on the rise. Police believe the same man is behind 5 burglaries in the Chelsea area, 3 near Times Square, 6 on the Upper West Side and Morningside Heights, 1 near Columbus Circle, and another in Lower Manhattan.
People are that hungry, come ask me, we'll feed you. We're not here to see anybody starve.
The owner of Lion's Head Tavern says his place hasn't been burglarized, but he knows how hard it is for restaurants right now, struggling to stay afloat during the pandemic.
Losing a few $1,000s would be bad, but I think the moral aspect of it is what really would get me down.
On the Upper West Side, Rana Novini, News 4, New York.
New York State is now taking action after the I-Team's reporting about an inflammatory illness that's impacting children, possibly linked to COVID-19. Now, the state health department has issued a health advisory now. This is after 64 children in the state have developed this unusual condition. News 4 government affairs reporter Melissa Russo was the first to sound the alarm on this, and she's live in the newsroom with what this advisory means. Melissa.
Natalie, that number, 64 children, stated in the advisory from the state health department today, is coming as a surprise, I'm told, even to some senior state health officials who, based on early manifestations of this virus, did not anticipate seeing dozens of children becoming critically ill. Racing to pediatric intensive care units throughout New York State, children in shock, and in some cases even cardiac arrest.
It was dire. It was incredibly painful.
Father John McMorrow describes the terrifying moments when his healthy 14-year-old son Jack took a sudden turn.
Approximately 2 weeks ago, he got sick with a small fever, and we overlooked the slight rash. And by Saturday morning, he had almost 105-degree fever. They ended up diagnosing him with COVID-19 related cardiogenic shock, which in most cases is fatal.
As the I-Team learned today, New York State hospitals have reported treating at least 64 children with these serious inflammatory symptoms, now believed to be linked to COVID-19.
What we're seeing are children who have had high fever for 3 or 4 days, and high fever meaning over 102, 103. Their heart rates are high. They tend to have rash, and the rash can be essentially anywhere on their body.
Dr. Steve Kearney runs the pediatric ICU at Morgan Stanley Children's Hospital in Washington Heights. He says he got a phone call yesterday from Governor Cuomo's state health commissioner, Dr. Howard Zucker.
What I've heard from him and from everybody is that this later onset disease is surprising to most of us.
On Monday night, the city sent an alert announcing 15 cases like this citywide. But Dr. Kearney says he's had more than 15 cases just in his uptown ICU, suggesting the city is undercounting cases. 1 week ago, the I-Team confirmed several additional cases at other city hospitals like Mount Sinai, NYU Langone, and Montefiore. Yesterday, the state health department sent an urgent survey giving hospitals 24 hours to respond. My colleague Katie Tur asked the governor about the subject during an interview on MSNBC this afternoon.
Has that potentially caught your health department off guard?
Well, I don't think it's caught anyone off guard, Katie. It's developing now. Apparently, they had a couple of cases in the UK on this. We're looking at it in New York.
Natalie, as you mentioned, the state health department has now sent out an alert to all hospitals requiring that they report every single one of these cases on a weekly basis. 14-year-old Jack McMorrow, meanwhile, is improving, thankfully, according to his dad. And Governor Cuomo also said today that he doesn't know of any children in the state dying from this syndrome, thankfully. Natalie.
All right, Melissa, opening so many eyes and keeping us posted every step of the way. Thank you so much for that.